ever feel thrilled to have been born a Homo sapien? I mean, the things that we can do, we can turn unborn chickens into cake and the snot of a fish into clothes. We really are an amazing, powerful species. But there is a species which I recently came to discover that's equally amazing and powerful. Yersinia pestis. It might sound like the name of a new TikTok dance trend, but it is in fact the name of a bacteria which causes the disease plague. And this tiny creature has been around for something like 5,000 years. To be that small and survive so long is quite an achievement in my eyes. Some other types of bacteria have survived this planet for billions of years and are possibly the earliest life forms on land. This is Sonali Acharjee, and you are listening to Health Wealth, a podcast that wants to help you build scientific understanding and a balanced perspective towards your well-being. I once saw bacteria under a microscope, and to me, they look like fat, furry cattails. The plant, not the actual animal's tail. And I remember thinking back then, how can something so tiny be so strong as to bring down someone like me? Because the truth is, bacteria have been and continue to be a huge threat to our health. And you might be thinking, well, that's not true for me. I'm very rich. I can afford antibiotics, the medicine used to treat bacterial disease. So how can these organisms be a threat to me at all? For the entirety of my lifetime so far, and I'm a 90s child, I have never had a single health issue that could not be treated by medicine. And today in 2024, we even have medicine to treat very difficult conditions like blood cancer. So I, and possibly you, cannot really imagine a world where if we cut our skin accidentally and got a bacterial infection, that we would have to die from just that one tiny breach in the barrier protecting our blood. But that world might well be our reality if we continue at the same pace as we are today. The latest ICMR estimate in India for increasing resistance against broad spectrum antibiotics is something like 5 to 10% every year. And some bacteria are becoming resistant to very important antibiotics, which is all the more concerning. So have the bacteria won? Today, at this very moment, are you and I safe? Or have we somehow, unknown to us, acquired drug-resistant bacteria as well? And if we have, what can we do about it? To help us understand the complexities of antibiotic resistance, we have with us today Anirban Mahapatra, who is the editorial director of the American Society of Microbiology. But he's also recently published a book on the subject of antimicrobial resistance. And he's here speaking with us on a personal note today. Hi, Anirban.
Hi, Sonali. Great to be on your show.
Thank you so much for coming.
Thank you for having me.
I thought we could just start with the very basics, just in case somebody out there has no idea at all about what we're talking about. So what is bacteria?
Yeah, great question. I think you introduced it very, very nicely. So as a human being, we tend to have a human-centric world, view of the world, putting ourselves in the center of everything on this planet. But as a microbiologist, I can tell you that that is absolutely untrue. So bacteria are single-celled organisms with very complex life cycles. They've been on the planet for 3.4 billion years ago, so they predate us by very, very long time. They are found everywhere. Everywhere we seek to look for them, and there are related organisms to them known as archaea. But these single-celled organisms can be found in the deepest trenches of the ocean, the highest areas of the atmosphere, and likely if we find life anywhere on another planet, it will likely resemble something that is close to these single-celled bacteria. And the other thing that we are coming to realize is that our bodies ourselves, which we consider to be very human, they make consist of roughly an equal number of bacterial cells
Mm-hmm.
than they do human cells at one point. So it's very hard to get the actual number, but there may be an equal number of bacterial cells or even more bacterial cells in a human body than they are quote unquote human cells. So a very reputed scientist who's working in this area, Dr. Michael
Mm-hmm.
Fischbach,
Yeah.
had a very interesting saying, which I'm going to paraphrase, is that the human body is basically a long tube with bacteria on the outside and bacteria on the inside. And this
Yeah.
is coming to, like, we're appreciating this a lot more with the understanding of how one a set of bacteria that form a microbial community known as the gut microbe
Mm-hmm.
influences every aspect of our health, our heart health, our mood, and how our body functions.
Yeah.
So not all bacteria are dangerous for us. Actually, we would not survive without them.
Yeah.
Yeah, so that is in a nutshell sort of the big picture of what
Yeah.
bacteria are.
We'd done an episode on gut health a while back, and I remember after that, now every time I get angry, I say it's something wrong with my bacteria today. One thing is there, whenever we come across news articles on antibiotic resistance or bacteria, there's a term which is used very often, and I think most of us won't know. So, what is gram positive and gram negative bacteria?
So initially, so this is essentially a staining technique to be able to categorize, and I mentioned this in my book,
Mm-hmm.
to categorize the differences, the broad class differences between bacteria. But this staining, so one of them, so they look different. They give you different colors based on whether they keep the gram stain or whether it washes out and you see a counter stain.
Mm-hmm.
So the key difference is that these two types of bacteria have different cell walls. So if you can imagine that you need an antibiotic to get inside the bacterial cell to be able to destroy it or to be able to stop its growth, then you can think of the cell wall as like the outside of a castle. And the gram negative ones have a very complex castle which is very harder to get through. So they're very smaller pores. They can eject out the antibiotics, as opposed to the gram positive, which
Yeah.
are easier to in general. Now that's not to say that there aren't gram positive bacteria that can cause disease. One of them is MRSA or MRSA.
Mm-hmm.
But most of the difficult superbugs, the ones that are hard to treat or are
Mm-hmm.
harder to treat, are gram negative because they have the more complex outside wall of their castle, if you will.
Mm-hmm. So, and now that we've started talking about antibiotics, I have so many questions about them. Um, why are these medicines so important to us as a species? And what happened before they were there? Like how were bacterial infections treated, if at all?
Yeah, you mentioned that it's so hard to imagine a world where
Mm,
simple cuts can cause something as serious as death,
mm,
or even giving birth
mm,
can cause infections. The former has happened. So this is a story that I recall in my book that there was a pre-antibiotic era. The
mhm,
first person who received the antibiotic penicillin
mhm,
was a police constable in the town of Oxford, and he had scraped or scratched his face while attending to his rose bush there. And he developed into a sort of a very serious infection on the side of his face. And he was given penicillin, which is the first antibiotic which had been discovered years prior by Sir Alexander Fleming. At that point, it was not available in a capsule format where you could get it. So it was very hard to isolate that drug. So he was given penicillin, and immediately he started to get better. But what happened was they were running out of the supply of penicillin. So they had to actually even extract it out of his urine because a drug is not fully metabolized inside the body. But
yeah.
even when that ran out, he passed away. So this gives you an example of the pre-antibiotic era.
Mm,
Unfortunately, if antibiotics don't work, we may be heading towards that era. And the reason I say that is like when children are born, sometimes in neonatal intensive care units, what
Mm-hmm.
happens is they pick up infections from others. And this is a cause of great concern right now. So I think about like 60,000 children each year, infants are dying in India
Mm-hmm.
alone of neonatal sepsis. And
Yeah.
even like in operations like C-sections or other operations, people are getting these hospital-acquired infections. So
Mm-hmm.
that has happened in the past, and that the fear is that that will happen very soon in the future as well.
Mm-hmm.
So so this gives you a picture of like how we went through this
Yeah.
period of time of like antibiotics were miraculous drugs, and now we're getting to the stage where so many of them are not working against infections. So before antibiotics existed, and if even few years before that, people didn't even know what bacteria were.
Mm-hmm.
So there were various techniques to deal with it in depending on the country. Like in the medieval ages, there was bloodletting, and using leeches in parts of the body to balance body fluids. In India, actually, there were a lot of herbal remedies that were used. And there was, even though they didn't know what bacteria were, there was some knowledge of hygiene practices and what to do to be able to prevent some of these infections. But another thing that we found out even during the COVID-19 pandemic is that isolation and quarantine are not new.
Mm.
They date back to a very long period. So
Yeah.
that was another way that some of these they weren't treating the infections in one
Mm.
person, but they were stopping the spread to other people.
Yeah. Actually, I find it so fascinating that as a species, we keep trying and trying again to overcome, all pathogens. And then we get there and then we find ways to ruin it. So tell me, how are we sort of ruining antibiotics today? Why are bacteria becoming resistant?
This is the crux of my book, and I think
Mm,
this is how bacteria differ from pretty much everything else. Like
mm,
uh, you think about the smartphone that we
mm,
have here. It has more processing capacity than the computer that was used to go to the moon. So with everything that we do, everything is getting better and faster unless you're coming up against another life form. And that is because evolution exists as a way, as a mechanism of trying to stop us from what we do. So we're
mm,
getting better at everything. Unfortunately, we are not getting better at treating antibiotics. We discovered a large number of antibiotics during this golden age from penicillin through the mid 60s. But from the 80s, there have been shockingly very few new innovative
mm,
antibiotics. It seems like the really easy ones that were there for finding, we already found. And
mm,
bacteria are very difficult to treat. First of all, because as I mentioned, they're everywhere. They're for part
mm,
of your body, and most of them are actually harmless. It's like certain situations where even a harmless bacteria can become harmful,
mm,
and they have the ability to mutate. So what happens is when a human, since we're talking about humans, we pass on our genes through offspring, and mutations can happen, but that
mm,
happens fairly infrequently. Bacteria, on the other hand, can double. So from 1 to 2 to 4 to 8, roughly every 20 minutes. So you can see
gosh.
like how they can grow
Yeah.
exponentially.
Yeah.
The other sort of superpower that they have is that they don't actually have to transfer from the parent to the offspring either. They have something called horizontal gene transfer. So if you can imagine like this crowded bus full of bacteria, and they're like people, and one of them is resistant, just by tapping on the shoulder of the next person, in this case bacteria, they can transfer that through something which is called a plasmid, a mobile element. So it doesn't have to even be like from the parent to the progeny.
Mm,
That is one of the difficult ways. So resistance doesn't stay where it happens. It gets transferred from not just from one bacteria to another, but from one species to another, making it incredibly difficult to control. So I
yeah.
think all of these examples are reasons why it's so
Mm-hmm.
difficult to treat these types of infections, and why antibiotics are not working anymore.
Yeah. In fact, you mentioned that, the world has seen very few antibiotics coming up. Yet we have seen a lot of antivirals coming up. Is there a reason why, and especially medicine for non-communicable diseases, those are, there's a new one coming out all the time. Why is it that the pharma industry seems to not favor antibiotics so much?
Very complex question with a lot with any thing like this. There is no really simple answer. One of the
Mm,
main reasons is we're not actually very good at creating antibiotics compared to other types of drugs.
mhm,
Most of the antibiotics that we have were isolated from soil, one particular form of soil bacteria. So
mhm,
you actually have to go out and get this soil bacteria, and you have to screen it, and you have to try to get it. And
mhm,
the ones that were easily extractable, we've already found. So now it's much harder to find antibiotics from soil bacteria. And pharmaceutical industry has spent a huge amount of money trying to synthetically create,
mhm,
chemically create antibiotics that work. But I'm sorry to say that most of them do not work as well as the
mm,
ones that we've isolated. So
mm.
that definitely is one reason that goes to the heart of your question about
Yeah,
antiviral versus
yeah.
antibiotics. Now, the
Mm,
question of cancer. So this is another thing. Like, first of all, we as a society have prioritized certain diseases over
yes.
others. Like in case
Mm,
of cancer,
mm,
um, companies will spend a lot, people will pay more, health will cover a lot more money for a cancer drug that will extend someone's life by maybe a month or 2 months, but will not pay the same amount of money for an antibiotic that might actually cure them for good for a
mm,
disease.
mm.
The other part of this is that there are already a large number of generics. So if you discover a new antibiotic, with anything that you discover, you want to sell as many units of it as possible as a company to be able to recoup the cost of your R&D, your research and development. But with
Mhm,
an antibiotic, we're talking about resistance, right? So anything that you create, you spent all this money, let's say maybe work for 10 years, and it's going to fall off a patent cliff and become a generic in another 5 or 10 years.
mm.
Yet, what we're saying is you have to hold it for only those severe cases of antibiotic resistance.
Yeah.
So they can't actually make that much profit off of that, as
Mm.
opposed to, like, I know you've probably talked about this as well, the hottest drugs right now, the
Yeah.
GLP-1 drugs,
Yeah.
which someone
Yeah.
has to take like regularly, or
Yeah.
statins for cholesterol. So
Mm,
these you can, like, those are cash cows because you create the drug, it's not for a short dose like an antibiotic, and
mhm.
you can immediately push it out to as many people as possible. So
Yeah.
there is a market effect here, a market failure and a market distortion, where the importance of antibiotics is not reflected by the process by which they're created and
Mm,
also by their pricing. So I think
yeah.
a lot of these issues together cause this. And so right now, to give you a statistics, there
Mm,
are only 27 drug candidates in clinical development for priority bacteria superbugs, compared to 1,600 for cancer treatments. And overall in the world, there are about 3,000 researchers who focus on superbugs and antibiotic resistance, while 46,000 are dedicated to cancer research. So there's a huge
huge
disparity in the
disparity.
number of people
Yeah.
working in these two areas, even though there's a statistic I quote in my book that we are heading towards a trajectory where more people will die of superbug infections than do of cancer right
Mm,
now.
mhm. No, no, it's a very scary world actually because we don't. I mean, for some reason, someone tells me somebody has cancer, I immediately get scared, and a lot of empathy, a lot of emotion
Right,
awakens in me. Versus, someone saying, "Oh, they've got bacterial infection." It's not appealing enough, I guess.
right.
So we know we've done an episode on tuberculosis, and that's a bacteria which is becoming drug resistant, and it's quite frightening as well. But are there other types of bacteria that we should be concerned about where drug resistance is growing?
Yes, technically, any sort of bacteria that can infect you can develop resistance. So we're talking about the causative agent for gonorrhea, as well. And I mentioned in my book 6 particular ones which are priority pathogens. So we talked about
Mm-hmm.
the difference between gram positives and gram negatives. So MRSA or MRSA, which is methicillin resistant Staphylococcus aureus, that's a
Mm-hmm.
gram positive, and then Streptococcus pneumoniae. And then there are 4 really deadly and worrying gram-negative bacteria as well: Pseudomonas aeruginosa, Klebsiella pneumoniae, and E. coli,
Yeah.
which is very much, it's actually a harmless bacteria in the gut. But the thing
Mm.
that happens is it can cause like serious infections in other parts of the body.
Mm-hmm.
So yeah, definitely a lot of
Yeah.
other superbugs.
In your book, you had you talked about what happens when the drugs don't work in an ICU setting. Can you maybe expand a little bit on that? Like, how do we end up dying finally? What is septic death, and how scary is it to be in an ICU now and you find that the drugs aren't working on the patient?
Lots of different stories, and I've heard, like,
Mhm.
even as I was writing this book, a lot of people reached out to me personally to tell them about some of the tragic incidents that they face. Some lost their own children. Other had parents who went in for an operation, and they suffered for much longer as well. So and so what happens is that physicians will try to treat these patients with a number of antibiotics, but if it gets down to sort of the antibiotic of last resort and it doesn't work, then patients may develop something called so sepsis goes on to septic shock, which is
Mhm.
a severe reaction to infection. And this may lead to widespread inflammation and the reaction of the body itself to the infection, tissue damage, multiple organ failure. So that is one way. And this can happen in a short amount of time,
Mhm.
or excruciatingly, it can happen to people over a very long and painful period where they have this infection. It gets treated, it goes down, then it comes back, comes to a different part of the body. So no less excruciating or painful or tragic than someone who has metastatic
Mhm.
cancer.
Mhm. See, I keep hearing, I mean, as a health journalist, I meet doctors all the time, and they'll give me two reasons as to why you might have drug-resistant bacteria already in you. So either you're misusing your antibiotics and you're stopping the course early, or you're just taking the wrong one. Or they say you've been having too much of poultry, which has been treated with antibiotics. And I keep telling myself that I don't have to worry. I've done neither of them. I'm very careful with my chicken, and I've never ever misused antibiotics. Is that true? Am I safe if I've not misused the drugs and I'm not eating poultry? Does that mean I don't have to worry about it?
Unfortunately, no. I think with any infectious diseases, especially as we saw with the COVID-19 pandemic,
Mm-hmm.
we are all part of a broader ecosystem, which is referred to as now as the sort of the One Health, where animals are in the environment and we are also a part of this trinity right now. It's I would say an analogy is someone saying, well, I don't burn fossil fuels driving a car, or I don't turn on the AC. Therefore, I have not contributed directly to global warming and climate change. Therefore, I don't have to worry about it. But you
Mm-hmm.
still have to live with other people in that environment.
Mm-hmm.
Resistant bacteria can be spread through contact with contaminated people. So yeah, that's one way. And so we still have to interact with other people. Resistant bacteria may unfortunately be inside us right now, and the burden of resistance right now is very high. So certain crucial antibiotics is greater than 70%. So there are estimates, and you mentioned the ICMR
Mm-hmm.
report,
Mm-hmm.
that crores of people in India already have resistant bacteria within them in
Yeah.
their gut. The reason it's not causing disease is that in that part of the body, it's not problematic. But if
Mm-hmm.
that were they were to become immunocompromised, or that were to
Mm-hmm.
spread into a different part of the body, then that could cause some sort of infection. Then now, I don't want to make it scarier, but to make matters worse, there are reports that pollution can increase the level of superbug resistance and spread of that, as well as climate. Now we're sort of in this situation where if you're in any part of India, well, obviously the climate is changing, it's getting warmer, and then the population burden is very high. But overall, also the local sanitation and hygiene practices impact all of us. So unfortunately, we can't separate ourselves from everyone else and make ourselves into, even if we ourselves have good practices with how we deal
Yeah.
with antibiotics.
Yeah. So it is a public health issue, from what I'm hearing. And so what can we do? In your book, you had a couple of solutions, and I found the one on antibiotic stewardship very interesting. I thought perhaps you could talk a little bit about that.
Yeah, so we talked a little bit about like what we can do on an
Mm,
individual basis, and firstly, on an individual basis, we should not indiscriminately be taking antibiotics just because
mm,
they're available at the local pharmacy, and we
mm,
don't need a prescription. We can go there and we think like we'll take it for, like you mentioned, like we'll take it for a couple of days and we'll get better,
yeah.
but we actually don't like. So that actually causes more resistance to develop by when we don't fully treat the infection. The
Mm,
other part of that is like most people think, okay, I take an antibiotic, mera kya jata hai? It doesn't really harm me. It's like this
mm,
is like the whole antibiotic resistance thing is like it's for the community, and I don't care about the community. But
mm,
it actually harms you because if you keep taking antibiotics over and over again, it can cause like disease causing bacteria to colonize your own gut. We are talking about because these antibiotics don't discriminate against like the what is the good bacteria
mm,
versus what is the bad bacteria. You're
mm,
actually killing off the good bacteria that you need. So in a hospital setting, antibiotic stewardship involves educating healthcare professionals on providing antibiotic usage. What are the
mm,
cases where antibiotics should be used for patients, and what are the antibiotics that should be used? So
mhm,
limiting the spectrum of the antibiotic or trying to tailor it towards the actual bacteria instead
mhm,
of giving like a nuclear bomb of a broad spectrum antibiotic,
mhm.
or one of the ones that we were talking about earlier that should be used only for very crucial cases where it's not treatable by any other form of
Yeah,
antibiotic. So yeah, definitely. And then also monitoring those prescriptions and
yeah.
resistance patterns to see that they match.
Yeah. In fact, I know a lot of the leading private hospitals in Delhi now, they take blood cultures first to determine exactly what
Right.
bacteria is there before they give the antibiotics, because it's getting that scary right now. And
That is the standard practice, and that should
mm,
be the standard practice. The reason that that isn't done is actually manifold. One is as a patient, sometimes you don't want to wait. You go in and we are also responsible. We force our physicians to say, okay, just give me, because we always think like the
yeah,
physician who comes with like a long prescription of like 5 or 6 things is better than
mm,
the one that says, I'm not going to give you anything. I'm going to take your blood test. The other
mm,
thing is that if there were tests like let's say for COVID antigen tests where you could have something like very with good sensitivity and specificity that you could
mm,
get like 20 minutes, you wouldn't have to wait for the whole blood culture. So I
yeah,
understand that that's also that there's also that waiting period, but
yeah,
it is important because as you know, like during the COVID-19 pandemic, so
mhm,
many people, like nearly everyone was given azithromycin,
yeah,
and it's like it became so common,
yeah,
although there's no evidence that they had bacterial co-infections, and it doesn't work for COVID.
mm,
So yes, so that's again another part of
yeah. So
something I wanted to mention.
in the US, for example, the pharmacist's role is very strong. Unlike in India where, you can get quite a few of the antibiotics over the counter. Or, I mean, it's also very easy to fake prescriptions or use someone else's and so on. But yet you have resistance in the US also. So is there something else that's also going wrong apart from the misuse of antibiotics?
It cannot be. So this is when one thing happens in one part of the world, we
Oh, it
are in
just
an interconnected world.
got it.
It affects everyone everywhere. And
Right.
there's also the issue of, of compliance with guidelines as well.
Mhm.
So it isn't so much that it's just the antibiotic use that's causing it,
Mhm.
but and in hospital settings,
Mhm.
uh, i- despite whatever practices they may have against sanitation and hygiene, it can spread. And I would also say in the US and in other parts of the world, there are a number of more immunocompromised patients as well that are
Mhm.
more susceptible to this compared to the general public.
Right. And, since you've done an entire book on this and you know so much about it, are you scared personally, or do you think, there's hope to look forward to?
So as a scientist, I am by my demeanor very optimistic because I know this can be scary, but
Mhm.
I've just returned yesterday from a scientific meeting where this was a topic of discussion, and then last month I was at a medical meeting, infectious diseases and clinical microbiology meeting, where a lot of people were talking about this. So there are a lot of things that people are doing to address this,
Mhm.
even outside of using antibiotics. But I
Mhm.
think all of this information is not widely available to the public, and that's one of the
Yeah.
reasons why felt that I needed to write this book.
Mhm.
And towards the end, towards the later chapter, there are some hopeful aspects about what people are doing, and even in India, which has a
Mhm.
very strong pharmaceutical sector. But I
Yeah.
think we need to raise awareness, and I think more needs to be done.
Yeah, I really share your optimism as well. After the COVID-19 pandemic, I feel that once we get our act together, we can conquer quite a lot of things. And awareness is definitely key to it. If we don't even know that we have the right to demand better policy and better regulation of these medicines, and we have the right to look after ourselves and to be aware of what's going on around us, then how do we even, get to that point of fighting against antibiotic resistance? So thank you very much for sharing so much with us today. It's been very informative. Thank you.
Thank you so much for having me.
Thank you. I myself have never misused antibiotics, and one of the reasons that's the case is that I have a doctor who I go to for every small thing, for every doubt, for every worry. I just go straight to the family physician. And it's important because I still believe that a doctor is better than an internet search. And that's where you get the real information, and it can really help save you from so many things. So if you are confused and you do think you have a bacterial infection or a co-infection, or you're just used to taking an antibiotic every time you have a flu, because that is the case in India, where very often we're just used to it. um, get your doubts cleared, and it's important to invest in a good doctor as much as it is to invest in a good car and a good phone. It's needed for our well-being. After listening to this episode, do you think we'll be able to defeat antibiotic resistance? And what role do you think the average citizen can play in the battle against bacteria? Do let us know your thoughts. You can write to us at pods@indiatoday.com, or you can message us on 8588966996. And if you enjoyed this episode and if it contributed to your well being in any way, please do rate us. We are available on Apple, Spotify, YouTube, and Google Podcasts.